From the Sunflower Shop, this is the Healthy Approach Podcast. I'm Bryan Bradford. Proper nutrition is one modality to helping your body get back into balance, and it's an important one. When you have leg cramps, we can take magnesium and it helps. When you have pain, you can take turmeric and it may help. Symptoms of the body being in dysfunction is not always a nutritional deficiency, so we need more help than just a nutrient. So today, I want to talk about other methods used to bring the body back into a state of harmony where your skeletal muscles and nerves send and receive the proper signals to fire properly. And I have just the person to talk to. Jennifer McCauley, owner of Inspire Physical Therapy and Wellness Center in Southlake. Welcome back to the show, Jennifer.
Hi, thanks for having me back, Bryan.
Well, the last time I had you here, we talked about the pelvic floor therapy and how it relates to constipation, incontinence, and even men's prostate health. So that podcast, It just blew up, Jennifer. So many people had heard about the pelvic floor, but really didn't understand what it's all connected to. And in case anybody missed that, I think that was episode 62 on sunflowershoppe.com. You got to go check that out because it's a very popular podcast to learn more about the pelvic floor. But Jennifer, I wanted to bring you back to talk about the different techniques you do that are available to support health issues, to help align the body. So just that everything works better because we know everything is connected. And as a nutritionist, I understand the body and the systems of the body at the nutrient cellular level. I make changes to the bodily systems by finding nutrient deficiencies that make the system operate, or I can facilitate a systemic action of the body with nutrition. You, on the other hand, use a different technique to restore function back to the musculoskeletal system, which can bring the body back to balance. And that's what I wanted you to talk about today. So why don't we start with what's orthopedic physical therapy?
So orthopedic physical therapy is what you think of when you think of traditional physical therapy. So you've got a neck ache, a back ache, you sprain your ankle. So it's anything dealing with the musculoskeletal issue. So if you end up having an injury, you want to make sure you go to the right kind of therapist for you. Many people don't realize in physical therapy that we can do so much. So for instance, somebody who had a brain injury would go to a neuro-based PT. So if you have an ankle sprain, you want to make sure your therapist is trained in orthopedics. So it's just making sure that you understand. But when you think of traditional PT, that's what you kind of think of.
That's right. But you do a lot more than just traditional PT. And that's what I love about what your office does. You know, full disclosure, I've been to see Jennifer. I've had some back issues and I was amazed at some of the techniques that she did that no one else has ever tried. I mean, all the doctors and other therapies that I've been to never did what you did. So I want you to talk about a lot of the techniques that are performed in your office.
So first of all, I want to kind of break the stereotype of what physical therapy is. I know there's this old adage when you go with the physical therapies, you get stem, ultrasound, and massage. So one of my biggest pet peeves is when somebody comes to me and they go, "Oh, you're a physical therapist, you must do a great massage." I didn't go to school for all these years and earn my doctorate to be able to do a massage. Not to discredit what massage does, they're a great and healthy part of healthy living, but what we do is so much more. So we do a variety of manual techniques and neuromuscular and strength training techniques. So first things I'd like to talk about are some of those manual techniques. So when they're asking, do you do a good massage? What they're basically asking is if we do tissue mobilization. So what I mean by tissue mobilization is anything we do to treat the tissue to either release some sort of trigger point or dysfunction so that we can restore healthy, optimal movement. Now, we do a variety of different tissue mobilizations here at Inspire Physical Therapy. So one of the first ones we do is something called the Graston technique. What Graston technique is a form of instrument massage to release muscles. So I'm going to show you real quick here what I mean by that. Let me grab my tool out.
And you said, is it Grasso or say that name again?
Graston technique.
Graston
Graston. So what we do is we use metal instruments and they rub along and they shape the contours of the body. We have 6 different ones. And what we can do is we can release myofascial restrictions. So if you think of fascia as like little planes of restriction, we can actually release down to the restricted level, We can actually even get into areas that aren't muscle itself. So sometimes fascia needs to be broken up around the kneecap, maybe in the plantar fascia, around Achilles injuries. And it actually helps facilitate healing because it breaks, it takes areas that doesn't have good blood flow and it brings blood flow to the area. So it's actually been helpful to restore ligament injuries. That's just one of the techniques. Another one we use is something called cupping. So a lot of people might go to their acupuncturist and get cupping done. And that's when they put the suction cups on you. Think of the Michael Phelps effect that everybody sees those like suction cups on people and they leave those little marks. The bruises, yes. But what I want you to think of with the cupping is it's actually, what it does is it decompresses the tissue. So as physical therapists, we want to restore movement. So what we do is we take those cups and we place them along fascial planes and lines, and we have you move through active ranges of motion. So sometimes, say you're trying to bend over, but there's a restriction right here, not really muscle, but kind of like a fascial restriction. We can decompress the tissue as you're moving through ranges of motion so we can help restore that natural healthy movement. Another technique we do is something called dry needling. So what dry needling is a form of trigger point release using an acupuncture-like needle. So it's called dry needling because I'm not actually injecting anything into the tissue. I'm using a needle similar to what you would use in acupuncture. We put it into the trigger point of a muscle. So just like you want somebody when you're really sore, you got a knot in your shoulder, you're like, if somebody just comes and puts their elbow in like the massage therapist does, it really helps me to feel better. We do the same thing, but we go all the way into the muscle to find the trigger point itself. We get it to release, and it has more of a neurological effect, which allows the muscle to stay released for a longer period. It's the big gun. It works phenomenal for getting.
It works great for me.
It is. Yes, you saw that. Yeah. You saw how instantly the changes.
I did. And, even for a lot of people who are scared of needles, I want people to know there's really hardly any pain to it. I mean, yeah, maybe just the first entry, but you do it such a good job. I didn't even notice they were going in. All right, Jennifer, there's one other very interesting topic that I've just been fascinated by, and that has to do with neuromuscular reeducation. I want you to break down what this is, what it does, because I think it's just a fascinating topic.
Yes, thanks for asking, Bryan. So neuromuscular reeducation is kind of my baby. It's what I'm really, really passionate about. And it looks at when we're managing injuries, we have to look at how the brain is actually firing to the muscles. So when we have an injury, so say you hurt your back, you herniate a disc, you get a sprained ankle, we have an inflammatory response that comes in. And what happens is it actually shuts off our little muscles that stabilize us. So in order to get those to turn on, we actually have to use our brain to turn those muscles on. Now, there are different techniques and modalities that we use to do that. One of my favorites is something called dynamic neuromuscular stabilization. So dynamic neuromuscular stabilization, or DNS as it's referred to, is based out of the Czech Republic through the Prague School of Rehabilitation. And what it does is it looks at how we move during our first year of life and how that is a blueprint for how we do all movements in life. The fascinating thing about this is you look at an infant, it's a healthy nervous system. If you've ever watched a baby move, they move in proper form, proper alignment. And the thing is that no one tells them to do this. The brain actually tells them to do this. They don't have to think, oh, it's time to roll over. Oh, it's time to crawl. Oh, it's time to stand. We create an environment for them to do this. Now we can actually put ourselves into these positions, and it actually helps us to download these motor programs so that we can move from these places. I've worked with professional baseball players, Olympians, to just 90-year-old women with this technique, and it is effective across all boards.
So give me an example. What does that look like on someone? If they're with mobility issues, let's just say an elderly person who's having mobility issues, what would you go through what's some of that process?
So for instance, oftentimes people have difficulty going into a squat position. Okay. Mm-hmm. Now, if you look at a squat position, if you were to turn a squat and lay somebody on their back, the squat position, think of a baby at 3 months old. The legs are in the air. They're kind of slightly turned out. They're breathing appropriately. Babies never pull their belly buttons to their spine. They're not trying to tighten their abs, squeeze their butt. They're just breathing and maintaining what we call intra-abdominal pressure. So if you take that and you put somebody in that position, they learn to breathe properly, learn to stabilize properly. Then you put them into a squat position. It is actually fundamentally the same thing, and it teaches them the motor control that they have lost, that they need to be able to do. So it translates over to movement so well. And that's why we actually use it with athletes a lot, because everything, even from a baby learning to roll like this, is the same thing as a throwing athlete learning to throw. So it's all these patterns can, if you can break them down to their fundamentals, it really helps to get those healthy movement patterns that you're actually driving from the brains to the muscle, instead of trying to just train the muscles themselves to respond better.
Is that why we need a re-education? I mean, since from being a baby to adulthood, what kind of things would make us lose that ability? Like you said, because maybe we're not breathing right, we're tensing muscles that shouldn't be tensed.
So that's a great question. So, most of us are actually, so like I said, all this stuff is kind of derived from when we were infants. So the first time we really start to see changes, I hate to say, is through kids sitting in school.
Yeah.
Sitting in chairs all day long. What do they say? Sitting is the new smoking. So kids sitting in chairs, we're not meant to sit in this position. What it does is it tightens our hip flexors, turns our butt muscles off. So we lose that ability. Computer use, tech neck, all of these things kind of pulling us forward into this position. So we start to lose that motor control. And then with just natural injuries that happen in our life, we have an injury, and if we don't retrain that proper movement pattern, we compensate, and we continue compensating for 20, 30 years until we start to wear down the joints, and we end up with pain later on. And everybody goes, you know what? I remember when I sprained my ankle, I couldn't ever walk right after that. And then they end up with a hip problem or a knee problem. So if you can go back to those fundamentals and retrain how the brain feeds the muscles, it's amazing what can take off.
Oh, I definitely agree. And I'm just thinking back to my past on why I've had so many back problems. And when you were investigating those issues, I mean, yes, I was in the
Mm-hmm.
military running in boots for many years. I mean, that was throwing my posture
It's
off.
not a running
All
shoe.
exactly. They weren't meant to be running shoes, but I can see
Yeah.
why that just all these things that are life experiences or even a car wreck, like you said, any of these things can throw off the proper balance per se, right? And you're just retraining
Yes,
that to be back in balance. Just amazing. I think
exactly.
that's a very interesting topic. Now, you also used a lot of Pilates type exercises with me too. So, how does Pilates play into this?
So, before I became a physical therapist, I actually started off in Pilates. And Pilates is a holistic way of moving. It's kind of similar to yoga, except we use resistant systems, but we use proper breath, proper alignment, and we use machinery to help us move through space. Pilates is an excellent form of rehab, because what it does is it takes gravity out of the scenario. We have low impact exercises, and we're able to move and watch how movement dysfunction sort of happens. So we have something called a reformer, and we can lay somebody on it, and we can watch as they're pushing out. Are they hiking their shoulder? Are they trying to compensate with other muscles? And we can train the nervous system to move in a fluid way where everything is in balance. So with Pilates, you'll notice that we kind of rebuild all the postural muscles. So all the muscles, I always say, like how your bone sits in your socket, all the muscles that kind of control that, all the muscles that build the architecture. So we rebuild the core muscles, then you can layer the strength training and things on top of it. So we like to really look at the whole body as integrated. If somebody is standing with their hip out to the side, look at my shoulder being dropped down. So that's going to be impacting things. So I can work on the shoulder all day, but if I don't correct the hip, I'm never going to get better.
That's
So
right.
with Pilates, we're able to look at all of those relationships and really kind of correct them all.
Well, that's why I love what you do, Jennifer. We think the same way that everything is connected. That's for sure. You
Is
do an
connected.
you do another therapy there that I don't think I've experienced yet, but I think it's called
No.
neurokinetic therapy.
Yes, yes. So neurokinetic therapy is looking at how the brain wires to different muscles. So let's say in traditional therapy, and I always like to think of a medical model. You're taught a lot of algorithms. If somebody has low back pain, you do this. If somebody has this, you do this. Well, with neurokinetic therapy, we're able to look at relationships of different muscles, and we're able to see who's working too much and who's not working enough. And we look at that in functional movement planes and we test them against each other. So, not everybody, what your pattern is going to be, may not be what my pattern is, may not be what your neighbor's pattern is. So, we're able to design and tease out what muscles need to be actually released prior to being strengthened. Sometimes we just try to strengthen our glutes or our shoulder muscles, but that's actually, you have to release something first because it's that muscle is being shut off. And what we try to do is figure out the lock and the key and the pieces of the puzzle so that you can get the results you want with less effort and less work. Again, it's all about retraining how the brain processes action to muscles.
That's what I love. That's just amazing to me. I think the body is so fascinating in so many ways, and so much we still don't know about it too.
It is. It's funny when I do this work, everybody looks at me like, how did you do that? Like I'm some sort of magician and it's my little party tricks I do. Like, how did that muscle get strong? It was just weak. And then you teach them how to do it. But we are all about empowering you with the knowledge
Hmm.
you need to take care of yourself. And that's
I
really
know.
what's very important to us.
I totally agree. So what should a person expect when they come in to see you, and also, who should see you? And you talked about baseball players and Olympians and such, but that's not the only people you
Oh
see.
no,
You
no,
need.
no. I just
Okay.
what I love to show is that all these different modalities can be applied to anybody with just any, stenosis of the back, low back pain, sciatic pain, elbow pain, any sort of anything of your neck, spine, elbows, shoulders, any of those sort of injuries. So, as far as what to expect when you come in here, our office is a little bit different. We get to spend an hour with our patient, which is really, really how we like to work. And in this hour, we get to spend time doing a very thorough musculoskeletal evaluation and kind of going through this problem solving technique that I was just telling you about, really figuring out what's going on, not as a generalized program, but what your body needs. Then we teach you, we have time to be able to do all the manual therapy. We use any of these manual therapy techniques I was talking about, and then do the neuromuscular retraining. So we want to design a home exercise program for you that you have the tools to know how to manage your symptom. I always say the home exercises I give you are like a pain pill for you. So you've got the tools now. So I released here, I activated here, you changed how you moved here. See, you're feeling better. So now take that, apply that, and then work on strengthening it. So next time you come in, we take it even to the next level and to the next level till we get you to where your goal is. Our
That's right.
goal is really to empower you to take care of yourself and not be dependent on physical therapy.
That's right. Same way here, power through nutrition the same way. Just teach people how to eat again and get the proper nutrients, and we're all in the
Mhm.
same boat, that's for sure. And I know we were
Yeah.
talking before the show started here about you expanding, so I know business is good for you. More and more people are finding you and aware of what you're
Yes.
doing. So that is awesome.
Yeah, it's
Congratulations.
been. Oh, thank you. It's been wonderful. We're about to get more square footage, build more treatment spaces, build more treatment rooms. We're actually bringing on a new laser into our program that has been super effective at helping tissues to heal. It's a class 4 laser, goes 4.5 inches deep. It helps cells to rebuild on a cellular level. Our patients are noticing phenomenal results with it. We are using it in conjunction with our physical therapy, and it's just another tool in our toolbox to help bring things, help the body to heal, which is what we believe we do, is have to create that environment. Nutrition being a key component of that, but cellular healing, proper movement, all of that is part of that as well.
I totally agree, Jennifer. It's all connected, that's for sure.
It is all connected.
Well, thanks so much for being here today again. And, I just hope we keep getting this word out of all these different techniques that are available for people to help them live a better and healthier life. And I think you're a big part of that puzzle for many people.
Well, I really appreciate that, Brian. Thank you so much for having me, and it's always a pleasure. And thank you for allowing me to share my passions with you, and just getting the word out because I want people to realize that there's so much more, and that we're here to be a resource for you to help all of you out. So,
Well, thanks again, Jennifer. We'll talk again soon.
okay, sounds great. Thank you so much.
I hope you enjoyed this episode of the Healthy Approach Podcast. Be sure to subscribe if you like this podcast and help us spread the word by rating and sharing with your friends and family. Check out the link below if you'd like to learn more about what Jennifer does, or for more information about what you can do for your health, go to sunflowershoppe.com. That's shop with 2 P's and an E, or visit us at one of our 2 locations in the Dallas-Fort Worth area.